Fantastic. Fantastic. Thanks for the thumbs up, Tammy. We will get started here. Welcome to this little mini class on sclerology. We think about sclerology, when we think about iridology, we often don't think about the whites of the eyes. So we're going to be looking at that today. If you need to grab yourself a quick cup of herb tea and a pen and a paper, go for it. Let's get this show on the road. Many of you, it sounds like, are health professionals. You're working with clients and you're looking for ways to assess your clients more quickly and easily. If you've got an iridology background, that may or may not be making your work easier. I find that the way a lot of people teach iridology actually makes your work as a professional harder, because you're looking at so many things and they didn't teach you how to laser in, how to ask the questions, and how to create a protocol to actually be able to do an iris assessment in under 10 minutes. Now, if it takes you more than 10 minutes to do an iris assessment with a client, I'm going to say you're doing it wrong. You might have the right information, but you're not using it in a way that is helpful. And the reason I say that is because your clients don't want to wait for a report. They also don't want long lists. They want laser points, and they want information they can make actionable right now. And they want information they can take home with them to work with right away. And that's a part of what iridology and sclerology does for us. Making our clients wait for a week while we write up a report lets them cool off, right? And when they cool off, they're less likely to follow through. They're less likely to come back. So we really want to make sure that when we are doing iridology, we are doing it in a way where we give them the information they need now to deal with the problem they're dealing with now. We can dig deeper on other issues at a later time, but we want to make sure we are digging in with it right. Jack says, you taught us the right way to do this. Yes, I did, Jack. Yes, I did. That was the whole purpose of it, right? You might even be a naturopath who can run various tests. Maybe you run like an IgG test or an IgE test for allergies, but there's a lot of false results with those. And so iridology and sclerology can actually help you to laser in better and be more accurate and precise in the work you are doing. We never use this to diagnose or name a disease, but it can certainly help us to laser in on what we need to know. So knowing how to use sclerology combined with iridology can reduce your assessment and program creation time, and so that you can get things done during your paid client sessions while they are highly motivated. And that means they're more likely to follow through, which means they're more likely to get results, which means they're more likely to come back and want more. And that's what we want here. We want our clients to get results, right? Is that what you want for your clients? If you want your clients to get results, give me results in the chat box. I want my clients to get results. I know I can't fix everything in one appointment, but I can fix them. I can give them information step by step, right? And we can build to the end result they're looking for. So this is a really important thing. Now, yeah, and everyone's saying results, please, and yes, and for sure. Fantastic, fantastic. So with that, I do these mini classes, yes, to share information, because like I said, teaching is in my blood. Actually, I'm a third generation teacher, not just of iridology. My grandmother was a teacher for, I remember seeing a plaque hanging on her wall. It was like for 45 years or something like that. And my father was a teacher for 20 years. And I've now been a teacher of something or one thing or another since I was 12 years old. So I've been teaching for over 50 years in various different areas. So teaching's in my blood. It's what I love doing. And because of that, a part of the reason for doing these mini classes is to introduce you to the opportunity of taking an iridology course with me. So this is what one of my students said, and then we're going to get into talking about sclerology. This is Angela Hodges. She is also a recent grad and a recent certified iridologist. You can see her testimonial on the International Iridology Practitioners Association. There's Peggy weighing in. She's also a course grad. She said, best course ever. Thank you, Peggy. Angela says, wow, that is all I can say. What a fantastic course with a fantastic teacher that actually cares about your success. I'm so happy that I found her. Jumping down a bit, I'm a registered dental hygienist and have been for 20 years, but I've been studying naturopathic and homeopathic modalities on the side to help my own family. Now I want to open my own business using iridology to help others be healthier. I've already signed up with Judith for her next class so I can brush up on the body systems and learn herbology along with it. So excited. If you're thinking about taking this course, don't hesitate. You will not be disappointed. So with that as a lead in, let's start dipping your toes in. What we know for sure is that both iridology and sclerology are assessment tools. They are not diagnostic tools. So what's the difference there? Diagnosis is naming disease and naming cures. Assessment is figuring out how all the pieces fit together to create the issues your client has so that you can create solutions for them. Do you see the difference between diagnosis and assessment? If you do, give me assessment in the chat box. Do you see the difference between diagnosis and assessment? Jack is saying, so thankful I took this course. Jack, thank you. I really appreciate that. Yeah, you're seeing the difference. This is so good because if we give a wrong name to a disease and we treat it according to that name, then we're giving the wrong treatment, right? And so we really want to be aware that we are looking for patterns, we're looking for imbalances, we're not looking for disease names. The iris shows us genetic potentials, right? It shows us where the strengths and weaknesses are and which organs want to negatively impact other organs. And the sclera shows us where the body is struggling now. So the sclera is very dynamic. Now, this might sound like the sclera gives us enough information with which to create a program, but the sclera alone doesn't help us to see the order in which the problems should be best addressed. For that, we need the iris. You also need a solid foundation in anatomy and physiology. Without anatomy and physiology, you will not be able to trace a problem back to its root and to figure out what needs to happen. All right, Jack says, I agree. Thank you, Jack. Thank you, Jack. We always want to have at least 2 indicators in the iris and or the sclera. We can combine between the iris and the sclera to teaching us about a potential problem, because each indicator adds a layer of depth to our understanding. One of those indicators almost always needs to be from the sclera, because the sclera shows us what's out of balance now, and it may even be showing us things that are preclinically out of balance. So things that are just sliding out of balance, but they're not out of balance enough to create a symptom or to show up on a lab test. Sclerology and iridology both take more than a mini class like this to learn, right? We all know that in a 45-minute mini class, you're not going to get everything you need. But this is to introduce you and to get you thinking about possibilities. When we dovetail iridology for the genetic potentials and sclerology for where the issues are right now, we get a clear picture of what to work on and in what order. Now, here's the thing. Iridology and sclerology are both learnable skills. The truth of any skill is the more you practice and the more feedback you get, the faster you get good at using it, right? Use it or lose it, but you also need the feedback. I really think that to learn iridology well, you need a live teacher and you need a mentor, someone who will correct you when you're wrong, pat you on the back when you're right, and help you see other possibilities. So with the best training, you'll also understand how to integrate what you already know about nutrition or herbology or aromatherapy to get the best results for your clients. looking at someone's eyes and being able to assess where the problems are and the order that you need to work on them in is not enough. You need to have modalities, right? You need to be able to offer your client ideas of what they can do, whether it's herbs or nutrition or diet or lifestyle or whatever. And so that's what we do in the dynamic iridology assessment system is we teach iridology and sclerology and how to integrate it with what you already know. So if you are an essential oil specialist, when we're practicing together as a class, I'm going to ask you for answers based on essential oils. If you're a nutrition coach, I want nutrition answers from you. If you're a herbalist, I want herbal answers from you. And that way we start sharing information across the board. And you actually end up teaching the other students in the class a little bit about what you do. Jack says, yes, I appreciated that. Fantastic. Fantastic. So we want to help you integrate this, not just learn iridology and sclerology, but learn how to integrate that. Now, some of you are going to look at what we're talking about today, and maybe you've got other training, like you're a registered nurse or you're a naturopath or a physical therapist, and you're going to find that with that background, with that anatomy and physiology that you've already got, iridology and sclerology will be very beneficial for you. All right, enough of an intro. Are you ready to look at some eyes? If you are, give me eyes in the chat box. You ready? Fantastic. Ooh, some of you are really fast with that typing. Call those lightning fingers. Fantastic. Wonderful. Okay. When we do an assessment, we look at the iris, we look at the pupil, and we look at the sclera. Each one of those things gives us different information. And what they do is they corroborate each other. When you understand all the different pieces and you understand how they work together, it builds out the story that you need to see. We have to understand how all of this information works together. So remember that the iris itself is primarily inherent. It's what's been passed down from the last 3 to 4 generations. The pupils give us unique information as well, some of which is inherent and some of which is dynamic. And we don't have time to go into pupils today because today we are focusing on the sclera itself. Now, the sclera is dynamic. It changes, and sometimes it changes pretty quickly. You know this if you've ever had an ugly cry. You know, you've had that ugly cry, you've gone into the bathroom to splash some water on your face and to kind of calm down and cool off, and you look in the mirror and you realize your eyes are very bloodshot, right? So you just stay there for a few minutes, a little more cool water, you know, maybe a cool cloth across your eyes, and within a few minutes, the sclera and those blood vessels calm down. And so we know that the sclera and the blood vessels in the sclera are very, very reactive. But what about blood vessels that are there even when you're not having an ugly cry? They are telling us your story of what your body is doing now. In the dynamic iridology assessment system program, we learn 12 of the most common sclera markers. What they teach us about a client's current health challenges and how to assess them in conjunction with the iris and with the pupil. So today we're going to take a really high level look at 3 sclera markers. The first one is one that is not even a blood vessel. And computers will show things differently. The resolutions and the color settings in your computer may make some of these things a little bit difficult to see, but I'm hoping you can see this fairly well. The first one we want to talk about is jaundice. So jaundice is something that medical personnel watch for, and depending on your device screen, again, this might be a little hard to see. Jaundice comes from the French word jaune, which means yellow. So when we look in an eye and we see yellow, can you see all this yellow in here? And there's more down here. If you can see yellow, give me yellow in the comments box. It's not a bright lemon yellow. It's kind of almost a bit of a dirty yellow. Fantastic. Oh, good. You're seeing it. Your devices are great. Wonderful. This suggests that bilirubin is not being conjugated properly, and it's an indication of liver enzyme imbalances that can be a part of bigger problems. Now, if you don't understand what bilirubin is and what it means to conjugate bilirubin, you're going to need to go back into your anatomy and physiology and do a quick review there. If you see jaundice, you need to ask questions to find out what the client knows about their liver health. Have they been diagnosed with something that would cause this symptom? Is it a benign situation that you could support with nutrition, herbs, and lifestyle? Or is it a more potentially dangerous situation? So this is a good reason, good example rather, of why you need a college level anatomy and physiology course under your belt before you learn how to assess via sclerology and herbology, because without the A and P, you don't understand what questions you need to ask. You don't understand how things are linked. You won't understand what you're seeing. So in this iris also, we have right here a fiber that is jogging around. And it's not that it's moved, it's always been there. That is in the liver reaction field. So now we've got sclera and we've got iris. So the iris is telling us genetic potential for the liver to be cranky or irritated. Sclera is telling us the liver is cranky or irritated, particularly when it comes to conjugating bilirubin. So this warrants a conversation. Now, we don't get to diagnose jaundice because we are not licensed medical professionals, but at least we understand what we're seeing, that for some reason, the liver is not conjugating bilirubin properly. When we know that, we can then ask deeper questions. We need to know a bit more about jaundice. What are the causes of jaundice? And what is this person's diet and lifestyle like? What is their medical history? Because that will help us to understand why this person has jaundice. So the story behind this particular eye is this. He's an older fellow in his late 60s. He does not drink alcohol, but he does take supplements, and he's not on any medications. He has worked in a lot of chemically toxic environments. While that won't change his iris, remember the iris is genetic. This is what his parents blessed him with. It will change things in his sclera, right? If that toxic exposure, or if there's been other things in his life that have created stress for his liver and his liver's not functioning fully, we are going to see this. So his liver is clearly not happy. And so if his concern was that he had noticed that his eyeballs were becoming yellow, we can suggest some dietary advice. We can suggest he spend some time in the sunshine, because natural sunshine or full spectrum light helps the body to conjugate bilirubin. We also might want to encourage him to go to his doctor and get some lab work done if he hasn't already done that. But at least we can start with some liver support. Maybe we're going to use some herbal things. Maybe we're going to recommend some dietary changes. But until his results come back through his doctor, he needs to stay well hydrated. He needs the sunshine. And we need to make sure he's getting adequate sleep and no skipping meals. Those are some very key things that support the liver in conjugating bilirubin. Now, also notice there's a bit of a gray cloud right here. Can you see the gray cloud? If you can, give me gray in the comments box. Gray? Fantastic. Gee, the internet's fast today. You people are doing a fantastic job as well. So when we see gray clouding, this is another sign we might want to chat with him about, as there are many potential causes, but one very common cause. We're not going to dive into that one today, but it is something that as we discussed it with this client, it was definitely a point of concern that needed to be paid attention to. next thing we want to talk about is the meander vessel or meandering vessel. So when we look in his eyes, you'll see this vessel that is all twisty turny. I always think these look like I'm in an airplane looking down at farmland and I can see those little rivers and creeks winding through the farmland. That's what it feels like to me. You will sometimes see them close to the iris, but often you have to get an actual sclera image to be able to see these. So this is a 70-year-old farmer. He is lean and fit and strong like an ox. His farm is small, so he doesn't have all of the big fancy tractors and equipment. He's got small equipment and he does a lot of the work by hand. Like when he's throwing bales around, he's doing it by hand. If he's mucking out the stalls in the barn, he's doing it by hand. If he's feeding the livestock, he's carrying buckets of feed to their troughs. But he does it on his own and he has no hired help. So what would he like my help with? Well, he came in because he's on my mailing list. And I had met him through another association and I got a new iridology camera. So I just threw it out to my mailing list and said, hey, if you want to come in for 30 minutes of my time, I'll shoot pictures of your eyes. I'll talk about 3 things in your eyes that I see that make me think we should pay attention to them. And I'll give you 3 recommendations. And so he was curious. He wanted to try it out. He didn't have any known health issues. So I simply looked at his irides for inherent indicators. And then I looked at his sclera for dynamic indicators to give my questioning and to guide my questioning and my investigation with him. I also checked out his pupil size and shape for a deeper understanding of what they could tell me. Now, his sclera has a lot of meanders. Like we've got some little ones down here. We've got this one. We've got another one up here. And that's just one side of one eyeball. So in our conversation, we talked about his health history, and we talked about his diet, and we talked about his lifestyle. We need that background information for context, because while many indicators have their own meaning, they also modify each other. And what the client is actually doing already modifies how we assess and how we interpret what we're seeing. If we don't have a context, it means that we're offering a very basic cookie cutter analysis. So understanding the context lets us go much deeper to create an individual assessment and a set of recommendations. So again, his sclerae show a lot of circulatory markers, and these meanders are a circulatory marker. In general, as well as they can teach us about circulation in specific organs. So while this fellow is lean and fit and strong, and his diet is pretty good, he drinks a lot of alcohol. He has several servings of alcohol every day. So I want you to think this through. Meanders suggest circulatory congestion. What causes circulatory congestion? Could it be constricted blood vessels? Could it be plaque buildup? Could there be other things that cause constricted circulation? Because of his alcohol consumption, I wanted him to check his doctor and get some labs, because his irides suggest there are inherent risks with his cardiovascular system, his lipids and his triglycerides and his blood sugar. So when we see this in the cornea, it again tells us liver enzyme imbalance, but we don't know exactly which direction that's going until we see some labs. And while we're waiting for him to get those tests done from his doctor, then, and that's, I don't know what medicine is like where you are, but here it's often, if you're not critical, it's often a 2 to 3 week wait to see your doctor, a 2 to 4 week wait to get an appointment with the lab. And then, you've got to wait for the results to come back, and it can take 4 to 6 weeks. But in the meantime, we can start with suggesting dietary changes that he could implement today. Now, here's the problem. To look at his fellow being lean and toned, you might not think he could be at risk for cardio issues or blood sugar issues. But his eyes tell us a different story. When we see these meanders, we know there is congestion in the circulation in various organs. When we see this white cloud at the top of his sclera, at the top of his cornea, it tells us again that he might have a lipid imbalance, a triglyceride imbalance, and or a sugar imbalance, and those often go hand in hand. So we know there are issues here. And when we see all of this together, we know what we need to do. And it's not going to be easy, because we are going to have to tell this older fellow who is pretty set in his ways that while he enjoys his alcohol, if he wants to protect his cardiovascular system, he needs to significantly reduce it. Not something he's likely going to do, right? We might be able to give him some herbs that would help, but they may not be enough to overpower the effects of the alcohol consumption. Is this making sense? If this is making sense, give me a makes sense in the comments box. Fantastic. Fantastic. Love it. Here is another one of my clients. She came into me, she was in her late 30s. She came in wanting help with allergies and depression, and both can have many physiological root causes. So let's start with looking at her eyes. And again, we need to understand the process here of allergies and depression. That's where your A and P comes in. You need to understand pathways for things. So the first thing we're looking at is we've got pinguecula in the sclera, right here and right here. Pinguecula tell us that, again, that the liver is likely cranky and that it's having problems processing proteins, fats, and calcium. When these pinguecula are yellow, we lean a whole lot more on issues with fat metabolism. Now, pinguecula do not dissolve. They will not dissipate. They can be surgically removed, but there's a high risk that they will grow back. It's interesting that these irides also show a very strong predisposition, according to TCM, or sorry, a strong predisposition towards liver imbalances. And TCM tells us that depression comes from the liver. So we've got iris markers and sclera markers pointing to the liver. So we're going to do some liver work. Maybe we're going to do some dietary work with her, some herbs, some lifestyle, maybe some emotional work as well, if you've got the training to do that. So this is a woman, she's a personal trainer and very fit, quite competitive. At the time when we took these photos, she was under a lot of stress. Her mother had been diagnosed with dementia and was starting to really slide into that. So daughter moved in with her mother to take care of her mother until they could get her mother into a care home. There's a long waiting list to get into dementia care here in this city. And so she had lived with her mom by this time for about 4 months. And it was pretty much driving her crazy. She was still working full time and needing to try to keep her mother safe and trying to help her mother understand what was going on, which is very difficult when you've got someone with dementia. So we decided to work slowly and methodically with her because she already had enough going on. I rarely do a clean sweep program with a client, but knowing what load she was carrying and knowing what some of her challenges were, we went very slowly. So we started with asking, could she increase the amount of leafy greens that she was eating in a day? She was already eating some, so could she just eat more? That's easy. It's just increasing. You don't even have to think hard to say, oh, I'm just going to throw an extra handful in. So that is good. And then we did a herbal formula to support her liver. And she's physically active. So and she teaches a lot of classes and does a lot of one-on-one training. So I encouraged her to make sure that, especially while she was taking care of her mom, that she also made sure to take care of herself, to get enough rest. And that's a challenge. That's a real balancing act in the situation she was in. I also added an aromatherapy formula to help her with the emotional side of things. Flower essences can really do a good job of buying us time to find better answers and helping us to get through a crisis so we can work harder. So we did all of those things, and we got some really nice results for her. She was able to get her mother into care. She was able to then take care of her mother's abode and get it cleaned out and offload it, basically. And then she was able to move back into her own home, which of course anybody would love to move back into their own home after that. So with this, are you seeing how the sclera and the iris can work together? I like what Jack says here. I have those, and she's meaning, I think you're meaning the pinguecula, Jack. I'm not sure what you mean. And my liver enzymes used to be off due to the medications I was on. Interesting. Yeah, we need to consider that prescription meds can create imbalances in the body. So iridology and sclerology both work together to help us understand what the imbalance is and how to work with it. And it takes training and practice and mentoring and feedback to get to where you can do this at a clinical level. And that's exactly why I teach the dynamic iridology assessment system for health professionals. And it's exactly why I teach it the way I do. Another marking we can look for is called an encapsulation. You can see we've got a little fish hook here. That is a partial encapsulation. You can see in the image that's on the right of your screen, there is a little loop in that blood vessel. That is a complete encapsulation. When we see an encapsulation, like the fish hook or the little loop, it suggests that there may be or has been an infection or a pocket of toxins that the body is either trying to sequester until it can be dealt with, or it's sequestered it and it's just holding it off to the side in a safe place, as safe as it can be, until it can be dealt with. These pockets can be so small that the client may not even be aware of them and may not be aware that there is an underlying issue, or they can be as obvious as a swollen gland, a cyst, or an abscess. Jack says she saw an encapsulation when her husband had a sinus infection. Very cool. And Jack, when the sinus infection cleared up, did the encapsulation disappear? That's an interesting question to ask. So can you see how when we understand, and she says, yes, it did disappear when the infection was gone. Very cool. Can you see how understanding this marking fully and knowing what its placement means as an indication of where the problem resides in the body gives you the upper hand in knowing how to clear the problem out? You don't have to use a broad spectrum antibiotic here, which is going to upset the entire biome. You can be very specific. If it's something that you know is happening at the skin level or at a surface level, you can address it at the surface level. If it's something that's happening in a specific organ, you can work with that specific organ. You don't need to muck around with everything else. You can lean on your other modality training to select the best method for resolving the issue. And that's what I really like to work with my clients. I like them to be able to with my students rather, I want them to be able to bring in their knowledge to learn how to resolve the issue. So, you know, I've shared all this information with you, and some of you have been with me before, and some of you are new to me. So I'd like to take a minute to introduce myself. My name is Judith Cobb. I am a level 3 certified iridology instructor with IPA. There are only 8 level 3 certified instructors in the world to date. And while these badges look like I've only been at it for 2 years, in truth, as a certified instructor, I have to upgrade my skills every 2 years. I've actually been a certified instructor with IPA for many years, 8 or 9 years, and I've been a certified iridologist and teaching iridology before that for many, many decades. Over the 4+ decades that I've been in this business, in this industry, I've developed many courses and taught them, and have written and self-published many books. They're all out of print except the textbook that we use for the dynamic iridology course, which is available in a digital format and only to my students. I am also a master herbalist and a professional member of the Alberta Herbalist Association, and I am a nutrition professional and am affiliated with the Canadian Association of Holistic Nutrition Professionals and the Canadian Association of Natural Nutrition Practitioners. And this is a lot of the reason why I really work with my students to help them integrate what they know into iridology. Right, so important. Here's another one of my clients. Let's talk about him for a minute. This is a 79-year-old, and when he came to see me, he had excess abdominal weight, and he wanted to lose that weight. He likes to go on cruises, and he was finding that he felt like it was the weight that was causing his knees to ache, that was making him feel miserable, all kinds of pain. He'd had prostate cancer and it was treated with radiation and hormones. He'd had lots of medical diagnoses from his doctor: congestive heart failure, irregular heartbeat, shortness of breath, reflux with heartburn. When we started working, he was on 8 different medications, including an anti-anxiety med to help him stay relaxed when he's having problems breathing. He also had a hiatal hernia, which was not diagnosed by a medical doctor, but I referred him to an osteopath to get assessed for that. So as I looked at his eyes and as I listened to his symptoms, weight gain and all kinds of stuff, and I asked him about his diet, I had to begin to wonder if we were looking at someone who might have an insulin issue and who might have too much uric acid in his body. So I started looking at his eyes, and I see the gray patch, which again, we don't have time to go into today. We can see he's got bits of pinguecula starting to develop. And he also has, right here, he's got what we call fermentation signs. He's got orange pigment in his eyes, and he's got dirty yellow throughout his eyes. So the orange pigment is teaching us that liver and pancreas want to be cranky. The yellow is telling us kidneys don't want to balance out his uric acid. And there have been some really good studies that suggest that elevated uric acid is a key player in both insulin resistance and cardiovascular issues. And so he brought his labs in. His hemoglobin A1C was very elevated. And he was at 7.7, which is very high. We want it to be under 5.7. He had low leukocytes. His lymphocytes were very low normal. His hematocrit was very low normal. His erythrocytes were low. His testosterone was low. And he had elevated triglycerides. So on the initial program, again, I just suggested that because of a little assessment that I do, that he might have a hiatal hernia. I can't diagnose that for sure, but I suggested he might. And I gave him some little exercises he could do while he was waiting to see the osteopath. We used berberine IR because we suspected insulin resistance. And we used glucosamine for a glucosamine blend for his joints and for his gut health, and some omega-3. We had a lot of dietary work to do with him. His breakfast was rice cakes with jam. Not the best breakfast. And so we got rid of the rice cakes, and we added protein, and we added more vegetables because he wasn't eating very many vegetables. and we got him to have eggs for breakfast, and we got him to walk for 30 minutes a day. Also suggested that he sleep on a wedge, right? Because that can help with hiatal hernia, right? It can help with the reflux. Within only 4 weeks, he was starting to lose inches. He came in after 4 weeks and he said, I'm wearing pants I haven't worn in 3 years. That's very cool. And he was feeling more energized. He was sleeping better. And he also was finding that there was less reflux. He was feeling less pain in his joints. Everything was starting to come around. We've continued to work together to build his program and help him just regain as much of his health as we can. He's got that congestive heart failure, which means that left to medical devices, it's just going to be a really slow, painful death, right? He will lose function as he continues to follow that. Doctors never talked with him about diet or about exercise or about what he could do to balance his blood sugars. They just wanted to have him on metformin, right? And so we've got things balancing out, which is brilliant. Oh, I love this. Thank you, Peggy. Judith is hands-on. I couldn't have asked for a better teacher for this course, and all of her courses have been educational and has helped myself and our family for our health. I wish I knew her 23 years ago. Thank you, Judith. Thank you, Peggy. Jacqueline says, even though I am a certified iridologist now, Judith is always available to answer any questions I may have. Thank you, Jack. That is important to me. So some health professionals want to learn iridology just because they do, and that's fabulous. After they learn it, they find that it helps them in so many other ways. And here's just a few of the things that it does do for them. It helps them to be able to do their assessments more quickly when they do it the way I teach it. And it helps them to be able to refine the programs more quickly. Being able to see those genetic predispositions and triangulate that with the sclerae, and then triangulate that with the client's symptoms and their diet really helps you to laser in. And it helps you therefore to be more accurate and to create programs that your clients can work with. I don't believe in clean sweep programs. I believe in building programs one step at a time. The fact is that too many health coaches spend too much time creating intricately detailed, difficult to follow programs that discourage their clients. And that's why I teach things the way I do. Most programs only teach markings. They don't teach the correlations of sclerology to iridology or sclerology to health risks. They don't teach you how to integrate what you already know about nutrition or herbology or anything else for that matter. They just teach you iridology. They don't include practicing on cases and feedback and mentoring. That's a problem. So the end result with dynamic iridology is you get faster results, better results, happier clients, repeat business, more referral business without spending hours and hours creating difficult to follow protocols. So if being able to assess your clients quickly and easily without using lengthy questionnaires is something that sounds like it would be fun or beneficial or helpful, that it could maybe change the way you work and help you see more clients in less time, that's a really great way to increase your income without even raising your prices. If getting rid of that lengthy questionnaire is a good thing, and if you want to have increased confidence in what you do, that all sounds good, then we maybe need to chat. Here's what another one of my grads says. Karen Choate said, she's a CNHP and she specializes in gut health. I just returned from a regenerative detox course where iridology is implemented. Most people I talked with did not have anywhere near the same experience with their iridology education. They had no support, unanswered questions, and a lot of confusion. Mostly they finished their classes not knowing how to implement what they had learned. I feel so absolutely blessed to have been taught by you. I feel totally supported, even still, as I've graduated almost 5 years now. This is an older testimonial. I don't think there's anyone out there practicing, educating, and teaching iridology like you. Love that. And Kimberly Zadella's, Christina says, I'd like to chat with you about level 3. We should talk, Christina. Kimberly Zadelis said, if you are wondering which iridology course to take, you can stop looking. You found it. Judith is an excellent instructor with many years of experience. She is a caring and compassionate person who is dedicated to the field of iridology and her students. I personally practice both Eastern and Western physiology medicine. She's also has a master's degree in imaging, radiology, and she works in a radiology clinic as well. She was very impressed with the layout of the program. She makes it easy for her students to balance work, life, and study. So if you are looking for an iridology program where you will be fully supported as you learn, where the learning is live, we do it by live webinar, just like we're doing now, except that your mic and your cameras are both on so that we can have conversations, then you want to consider this. I will warn you up front. I only accept students who already have a college level anatomy and physiology course under their belt, because we don't teach A&P in this course, and I don't have time to review those kinds of things. When my students come to me with that foundation, we can go much more deep and much more quickly and really get some good things happening. The purpose is to teach you iridology and sclerology, to teach you how to integrate that into the work you do with what you already do, and save you time in working with your clients and in creating their protocols, right? And when we do that, it means your protocols are much easier for your clients to follow and stick with. So, so important. Why do I have a blank slide? So again, you need to already have an A&P course, preferably with a grade over 80%, because that is also a requirement with IPA in order for you to certify. You need to have proof of that A&P with a grade over 80%. If you're a licensed RN, chiropractor, a licensed naturopath, an ND, an MD, any of those, your current licensure will count. An EMT, a massage therapist, as long as you're currently licensed, that will count for your A&P. You will need to, if you want to learn this by Peggy, if you want to learn iridology at a professional level, then we need to talk. If you want to learn how the markers play off each other, if you want to learn what questions the eyes want you to ask, the eyes guide our questions. If you want to learn how to create programs your clients can be more successful in implementing, we practice program creation. Jack says, I have to go too, but I highly recommend this class. Thank you, Jack. Thank you for that. So we are we actually practice creating programs, creating protocols, so you know how to apply this. If you want to be mentored for the long term, and I am talking years, not just when you're enrolled in the program, then I want to talk with you. And this URL is not correct. I thought I had fixed all those. Ignore the last part of this. The proper URL to book a time to talk with me is tinyurl.com/dynamic-iridology. Ignore the rest of this. All right. We need to have a chat. You can only, if you want information, we'll chat. If it sounds like it's a good fit, I will offer you the opportunity to enroll. There is no enrollment link that is open to the public. You have to go through me to get the enrollment link. The course is 20 classes long, 2.25 hours per class. We meet once each week. We hold an extra 2 live mentoring webinars each month to give you extra support. And you can keep coming to these mentoring sessions for as long as you want, even after you've completed the course. We have 225-page digital downloadable textbook for my students only. And my students can print up a copy of this textbook if they would like, if they want a hard copy of it. 45 pages of cheat sheets, digital downloadable, again, for my students only. I don't sell these outside of the class. They are for my students only. Small class sizes, I limit my classes to no more than 10 students. Making sure we have time to answer your questions and get you feeling really confident is critical to me. So I limit my class spaces. Now, if this course sounds like, oh, mentoring for certification exams, absolutely. Again, on the URL, ignore the back end of this. If this sounds like something you are interested in, then I'll paste the correct link in the chat box for you. There we go. Then use that link, schedule a time to have a little Zoom meeting with me. We'll talk about where you're at. We'll talk about your goals. We'll talk about, do you have the A and P? We'll make sure everything is great. Talk about tuition and payment plans. And we will, if it's the right fit, we will get you enrolled. All right, the next course is starting, there's the right URL. The next course is starting on November 1st. So it's coming up in just 6 or 7 weeks. And we are just now opening registration. So if you are interested in learning more, then we need to have a conversation. Again, if you've already got your A&P or you are a licensed health professional and you want to learn iridology at a clinical level in a way where you will be fully supported during the course, afterwards when you're preparing for certification, and even after that, we should chat. I don't know of any instructor that offers that kind of mentoring support and feedback. And I know that because I have had other students who are already IPA certified who have registered for my class because they were not getting support from their original teacher. Right? And so that to me is sad, but I offer the opportunity for them to enroll. We go much deeper than most IPA teachers do. All of my previously certified IPA students always are saying to me, by the end of the 5th lesson, I can't believe how much more I'm learning here, right? So that's the goal. I don't just want to teach you iridology. I want to teach you at a level that will make you professionally competent and confident. Very important. So with that, my friends, thank you so much for being with me today. Just before we go, any other questions about what we've talked about today that I can answer for you? Give you just a minute to maybe lightning finger something in. It's been a lot of fun, and I hope that's given you some feedback. How do you get pictures remotely? Gina, that's actually something we do talk about in the course. I teach how you can get photos remotely. It's never the best, right? Because it is, because it relies on other people getting them for you, right? And so we cover that a lot in office hours. A lot of my students need and want that information. So we cover that. Absolutely. Good question. Anything else I can help you with? If there's nothing, then I think we'll wrap it up for today. Have a fantastic day. And for those of you who will want the replay, it will be out tomorrow. So watch your emails, and we will hopefully see you next week. You've noticed that these minis are moving around for days and times. We're just experimenting with some things. So really watch your emails to find out when the next mini class is going to be. Look forward to speaking with you soon and hopefully talking with some of you about the Dynamic Iridology program. Take good care. We'll talk to you soon. Bye for now.